Hey everyone, just want to give y'all a little update on everything that I have going on. I went not long ago and had an ultrasound done of my legs to check out my blood vessels, just to make sure there wasn't like an insufficiency or blood clots or anything like that, and all my blood vessels are in my legs. They're all good, functioning as they should be. And I also went and had a nerve study done on my legs. My son has a medical condition and it causes neuropathy. There's a specific type of neuropathy that you get from the condition he has. And so I went in just to make sure that I don't have it. There is like a blood test that you can do, but this nerve test is the fastest way to know if you have this. And so I do not have this medical condition that he has. I do carry it. Unfortunately, he has it with all of its horrible symptoms. It is Charcot-Marie-Tooth disease. If you don't know what it is, you can look it up, but it is a horrible thing. It is progressive. It causes neuropathy. He has weakness in his hips down to his feet. He has high arches, hammer toes, all of his tendons, ligaments, everything, cords, they're all extremely tight. He has done physical therapy multiple times, and like I said, I do carry it, but I do not have it. However, during the nerve study to see if I had neuropathy that was connected to this disease, I actually do have neuropathy. It is from my knees down. Above my knees, my nerves are completely normal. But from my knees down, I do have neuropathy. Now, neuropathy is like a symmetrical thing. If you have it in one side, you'll have it in the other side. However, the symptoms that I'm having, I'm only having in my left side. So I feel like an electrical current run through my left foot calf from my knee down. When I sit in a chair like this, when I'm sitting in like a dining chair, I have like numbness, and it's usually past like above my knee, but the doctor said that the numb feeling can travel up higher than the actual area that has neuropathy. My middle toe on my left foot goes completely numb, and sometimes when I sit in hard chairs, my whole foot and my leg is completely numb. And there is no cure for neuropathy. I do use a vibration plate to help with my lymphatic flow, because I do have lipedema, which I'm still going to occupational therapy for that every Friday. And I went to an orthopedic specialist yesterday because I have scoliosis. Now, I first knew that there was something really bad wrong with my back in 2007. I was pregnant with my first child, my son, and I had horrible back pain. And it's kind of in the center of my back, but I feel like it's mostly like towards my right shoulder. And doing things like washing dishes, sweeping, like repetitive motions where I have to like really like pull my shoulders forward to use my hands, it causes me a lot of pain, kind of like muscle pain. But I had got some test results back from when I got an x-ray done on July 30th, I believe I got the x-ray done. No, July 30th, I went to the hospital because I was having severe pain in my, under my left rib, like closer to my spine. And I thought maybe I had something wrong with my kidney. But it was August 1st. So I went to the hospital on the Wednesday, the 30th, and then on the Friday, I went and got an x-ray done because I had requested that my regular doctor send me to ortho. I had seen a specific doctor after my car accident, and I was asking to be referred back to him. And so I went and got an x-ray done just so that I would have like a new diagnosis, because my insurance won't let me be referred to somebody without like a good reason. And so once those x-rays came back, they did give me a referral. They could not get me in with my previous doctor because I was seeing that doctor through my attorney because of the car accident, and they do not take my insurance, so I had to go to a different doctor. So I went yesterday to this new doctor for the first time, and I was called back, and there was a x-ray tech who did all my x-rays, and then I was told to go into the room and that somebody would be in with me soon. So this doctor walks in with the chart that the tech had left at the door. You know, they have little slots on the outside of the door where they put the charts in. Well, that chart, the chart was put there, and the doctor came in and he says, how long has it been since you were diagnosed with scoliosis? And I told him that it was probably in 2008, around that time. Probably just after my son was born. I think he was like almost a year old. Because when I was pregnant and having the back pain, I went to the hospital. And I was like in 2007. They told me it was probably a pulled muscle. They didn't see anything wrong with my back. And so he was almost a year old, or just at a year old, whenever I finally told my doctor that I was seeing at the time regularly. I said, look, I'm having severe pain. You have to do something. I told you this during my pregnancy, blah, blah, blah. And she's the one who diagnosed me with scoliosis. So that was back in like 2007, 2008. Well, he walks in, asked me when I was diagnosed. Now, I did have a procedure done back in 2017 after my car accident. It was a nerve block, and that was done because I was in significant amount of pain in my back. And the procedure was done to see if maybe if they burned off those nerves, if, you know, it would help. So the nerve block did work, but in 2017 I was living a wild life, and I really did not care about anything, because honestly I was doing a lot of drugs at the time. So after this procedure, I just didn't go back to this doctor, and I really should have. But I haven't had significant pain until like June, July, and then I went to the hospital because I thought it was my kidney. Anyways, fast forward back. I've had all these issues and these doctor's appointments, and I've had procedures done for my spine and everything else, right? So after he asked me when I was diagnosed, he says, and you also had a procedure done for this nerve block? I'm like, yes. He says, well, you don't have scoliosis. You don't have anything wrong with your spine. There's absolutely nothing wrong with you. And I'm like, yeah, there is something wrong with me. And so he just keeps going on and on. He asked me to like do all these things to check my strength and weaknesses and blah, blah, blah. He's like, you are fine. And then he walks out and he's talking to the nurse, and he told the nurse who I was, like the name that he had on the chart. And she's like, no, that's not who that is. This person right here is this person. And so they had my chart mixed up. So he told me that there was nothing wrong with me, showed me the x-ray, felt my back and everything else, and he had to come back into the room and basically said, oh, well, it was the wrong chart. You do have scoliosis. You do have degenerative disc disease. And I'm just like, not happy. I really wanted to just laugh in his face, because he like put off all my pain and was, I mean, obviously the x-ray showed there was nothing wrong, but it was not my x-ray. It was the x-ray for the lady who had the appointment at the same time as me, who was in the other room. So our charts had got switched, our x-rays had got switched. So I have to do 10 physical therapy appointments, and if I'm still in pain after those appointments, to make an appointment with this doctor's office again, and continue going to up to 14 appointments, because really what I need is an MRI to look at my spine, but my insurance won't cover it until I've gone to physical therapy at least 10 times and I'm still in pain. So they gave me a back brace, they gave me a prescription for Narco, which Narco makes me really sick. And I told the nurse, I'm like, look, Narco makes me ill. And she says to take it sparingly. So you're giving me a prescription for pain medication. I tell you that this specific medication makes me like so sick that I really can't take it. And I'm told to take it sparingly. I don't really know how that is like helpful in any way, but they gave me a back brace. I'm not supposed to wear it like if I'm in bed or if I'm like lounging around, you know, like on a sofa or anything. But if I'm like, I've been wearing it while I'm driving, because when I drive, like that's a time where I really get like muscle spasms in my back where I have the curve in my spine. So I do have degenerative disc disease, and I have a curve in my spine, in my thoracic spine. So it's like just under like my rib cage, it curves. And it's, the angle is 35.7 degrees, which isn't, it could be much worse. It is moderate to severe, is what I was diagnosed with. And then like, so, you know, it's curved a little bit, but my spine is actually like, it's turned out some. So on the x-ray, you can see kind of like the side. It's like that, like the side of it. I don't know. I'll try to attach the picture of it on here, but I am glad that I'm getting all this taken care of. It is frustrating, especially whenever they mix things up, but things are moving along. I'm glad I'm getting some answers, and it's not all good news, because, you know, I do have medical conditions and a lot of things that I've just like put off for a long time, but I feel like I'm getting the help that I need. I do go to occupational therapy, and I did request that the referral for physical therapy is at the same office, because I kind of already know like the area and everything. Like going places that I've never been before gives me a lot of anxiety. I'm trying to get over that, but on other news, so my 14-year-old, she has a lot of issues with her digestive. She is lactose intolerant. We did believe that maybe the lactose was causing her to vomit, but right now really the only symptom she gets from lactose is constipation. She is still vomiting though. It could happen 1 or 2 times a week, but sometimes it happens like almost every time she has like a full meal. She is going in the morning to have a procedure done. She's going to be put under like mild sedation. So she'll be asleep, and then they're going to do an endoscope, put the camera down. They're going to look at her esophagus, her stomach, and her top, like her upper intestine, the beginning of it, and take some biopsies. Now, it is I'm guessing, you know, she has a lot of symptoms of gastroparesis. This child does not want to have this procedure done. And at 14 years old, she doesn't know the potential severity of whatever this is, because she does throw up so often. She will not talk about her emotions. She doesn't want to have it done, but at her age, I have to consider, you know, what is best for her, and this procedure is going to happen. So if y'all can keep her in your prayers, that would be great. I would appreciate it. I know that the good Lord has his hand over her, and I just pray that you know, he has his hand over the surgeons as well, and just touch her heart, because she is not wanting to do this procedure. I don't know if she's scared or nervous or what, but it's just coming out as defiance and anger at the moment. So I even tried to get her counselor to talk to her about it, and she refused to talk to her and ended their session. She sees a counselor at school. just trying to make this transition because she is going to a new school, and I wanted her to know this counselor and be able to have an open communication with her. But my daughter is really like hard-headed and does not want to let anyone in to her personal feelings. So anyways, she is struggling with this, and I know she is, but she won't talk to anybody about it. So like I said, if y'all can just pray about it, pray for her, and pray that we get answers that we need to help her with all the things that she's going through. So that is my update. Today is day 27, so 27 days carnivore. I have ate a few avocados, probably like 2 avocados, but like not all at the one time. And I've ate a few pickles. Not a whole lot, but I have eaten them. And I was about 12 pounds down. 12 pounds since December 10th. Now, I didn't start carnivore, not December, July 10th. On July 10th, I weighed myself, and I've lost 12 pounds since then. So not all just on carnivore. I was trying to lose weight before I started carnivore, but I do feel really good. I have no inflammation. I am really happy with how I am. And this was just an August challenge, but I have decided just to continue with this lifestyle as long as possible. My son's 18th birthday is coming up, and he's gonna have cake and probably ice cream. And I don't plan on cheating on that day. If I do, I do, but I really want to do this long term, and just see how I feel and how everything is going for me. And I'm excited for, this journey. And yeah, so I'm doing really good. I actually bought a pack of beef cheek, and I cooked it in the Instapot yesterday. Highly disappointed with the amount of fat and grease. It tastes great. The meat tastes great, but there isn't a whole lot of meat because there's just so much muscle and tendon and connective tissue and stuff that there wasn't really any like good meat in the whole pack. I spent like $30 on it, which is disappointing. So we'll not do that again. So I don't advise you buy beef cheek. We do buy like whole head of cow, and then we'll eat the cheek, off the head. But purchased the way that I purchased it, I was not happy with it. So anyways, I'm gonna let y'all go, and thanks for watching, and y'all be blessed.